The National Economic Council and Nigeria's Center for Disease Control have agreed to further strengthen COVID-19 response across the states. NCDC Director General Dr. Chikwe Ihekwazu briefed on a virtual NEC meeting presided over by Vice President Yemi Osinbajo.
We agreed on several measures to strengthen the response further. One of these was to set up fixed sample collection sites in every state so that going beyond the outbreak response, that there are fixed sample collection sites where people can go to when they think they have COVID, most likely within a hospital premises, and have access to testing, make it a lot easier for people to walk in and request a test.
He said the impact of the pandemic on other healthcare services was also discussed.
At the peak of the outbreak, we saw a reduction in access to other critical healthcare services. Immunization services, family planning, cancer care, routine health services all went down. So right now, over the last month, we have seen a pickup in these services, and we continue to encourage people to come forward for their health services. Doctors, nurses, healthcare workers, lab scientists have all been trained, retrained on how to protect themselves and how to protect their patients.
Ihekwazu said the Vice President and Minister of Health warned against complacency.
The Chairman of NEC, His Excellency the Vice President, and the Honorable Minister of Health, who also attended the meeting, warned against complacency. We must not look at the curve and think we have come out of this. This virus will remain with us until we have a vaccine and until we have distributed that vaccine across the country. Until we get to that situation, we have to keep doing the work that we're doing. So the excellencies, the governors of the states, members of NEC, His Excellency, the Vice President of the country, re-emphasize the fact, finally, that health security, protecting our health security, will remain front and center of the work at every state. So every state government agreed to strengthen their state epidemiology teams, strengthen their public health departments in order to focus on the response while we reopen the economy. So we have to do both things in parallel, and every member of NEC committed to doing both. One, strengthen the public health response while reopening the economy.